Doctors Without Borders, MSF, says it's concerned about HIV patients who arrive in South Sudan's health facilities after traveling for days, resulting in delays in antiretroviral therapy and very late diagnosis. Estimates indicate that in 2023, between 41% and 62% of individuals living with HIV knew their status, with less than 1 in 2 people receiving treatment. Ongoing conflicts and frequent natural disasters are some of the major factors hindering South Sudan's responses to HIV and tuberculosis epidemics, which collectively contributed to a third of deaths among adults aged 15 to 49 in 2019. MSF is calling for Buai Tut Chol, MSF Deputy Medical Coordinator in South Sudan. Welcome and thank you for joining us on News Now.
Thanks for having me.
All right. What is the current status of HIV and tuberculosis diagnosis and treatment in South Sudan? And how does it compare to previous years?
Well, it's estimated that there were slightly over 143,000 people living with HIV in South Sudan as at the end of 2023. That's last year. And it's also estimated that about 7,600 of these were infected only last year. This is according to the World Health Organization and the National Ministry of Health. Now, South Sudan is a country that doesn't have a large population like that of Nigeria. So talking about a disease that's incurable, these are not small numbers. And when it comes to tuberculosis, it's estimated that the incidence of the disease is 227 persons per 100,000 population. And out of these, you will find also that there are 5 people per 100,000 of the population that's living with DRTB, that's drug resistance TB. So it's quite challenging. And even more important regarding HIV is that only 47% of the people, the population I refer to, that know their HIV status is on ARP, on antiretroviral treatment. So this is quite concerning. It means you have more than 50% of the population that's not on HIV treatment, and this is these people who continue to spread the disease. We see people coming very late in advanced stages, coming to our facilities seeking care. So this is the situation that we are in South Sudan.
All right, let's talk about how accessible the HIV testing services are, especially in both urban and rural areas of South Sudan. How accessible is it?
Well, South Sudan has fewer health facilities than it should, and this is even more a problem in the rural areas. So, whereas relatively more people may have access to HIV testing and treatment services in the cities like Juba, the capital of South Sudan, in the rural areas, access to healthcare in general and to HIV in particular is quite limited. You have populations living far away from healthcare facilities, and they are not able to come to the facilities. And this is also coupled with issues of awareness and poor health-seeking behavior. You know, there's need to do more to make sure that the services are accessible to the people.
All right. Can you tell us what specific improvements you believe are necessary to better address the HIV and tuberculosis diagnosis and treatments in South Sudan?
I have referred to data earlier of the prevalence of HIV and also the incidence rate of TB. But then this also needs I mean, the issue of data, access to data is quite limited here because of the fact that the health service, the Ministry of Health is under-resourced, and so data comes in very late. There's need to improve funding in terms of improving data, so that you have to have data to be able to plan, to be able to put more resources. And in general, there is a need to provide more resources. There is need to increase funding for healthcare in general, but for HIV and TB in particular, from donors as well as from the national authorities, the Ministry of Health. There's a need to recognize the circumstances under which people are living in. There's conflict, there's displacement from natural disasters. And so there's real need to adapt policies and practices that recognize this. There's need to decentralize TB and HIV care and bring it closer to the people. There's need to provide longer drug refills for people living with HIV. Instead of providing 1 month of treatment, it will be more important that they are provided with longer refills, like 6 months or more than that, because then the chances of default can be reduced.
All right. I want to thank you so much, MSF Deputy Medical Coordinator Buai Tut Chol, for joining us and telling us about the current situation there in South Sudan. Thank you for your time.
Thank you very much.